Hey everybody, Tim White, clinical specialist here with the Aspen After Surgery Center. We are here with our latest patient, Quinn, who's agreed to shoot a video with us about our 5-day fast track program. So Quinn, you're basically graduating the treatment portion, but you're going to go home and do some more stuff. How'd you do?
Amazing. I was a little suspicious of doing this treatment. I knew it was very like a homeopathic thing to do, so I was like, let me do this with my background after doing a virtual interview consultation with Dr. Tim, and I am so glad I did it. I have so much more softness and responsiveness with my implants that I didn't think I'd have after 5 days. So,
Awesome.
super happy I did this.
Our pleasure. Just to preface, thank you for the term. I am not a medical doctor. I'm a licensed physical therapist, but I get it. We wear the lab coat. So I get Dr. Tim a lot, but to not offend my professional colleagues, I'm a 20-year practicing physical therapist and the designer of the program because we're specialists in soft tissue, and that's exactly what we work with you. Now, I'm glad you're suspicious because, you know, those people that don't get suspicious get stitches.
Yeah.
West Coast, East
West Coast, yeah.
East Coast. I can't even make the motion.
Yeah. There you go. There it is. There it is.
So, but that's a good point because if she had not been suspicious and Quinn had not done her homework and her research and had not found us, which is why we do these videos, because we want women to find out that you do not need to have surgery for capsular contracture. There's a non-surgical solution, no different than I therapeutically practicing 20 years, can correct a frozen shoulder, a knee that's not moving, a scar after a burn or a trauma. We have developed new technology and treatment protocols that help treat this, and you're the victim, the recipient of that, and now you're better. So let's make this scientific, right? Scientifically, both your breasts were encapsulated. So the interesting part about Quinn is, besides being beautiful, she's a beautiful cocktail of being a black woman and an Asian woman, which interestingly produces that she is the #1 and #2 category for genetic predisposition for implant contracture. So anybody out there watching this, if you're an Asian woman, you typically tend to have bilateral contracture, meaning both your breasts. If you're a black or a Latin woman, you're in the #2 and #3 category for the highest. So sometimes patients get contraction and they're like, it was my surgeon. He didn't have a good bedside manner. Has nothing to do with it. Well, we use silicone versus saline, doesn't matter. The technique doesn't matter. I didn't massage, doesn't matter. Vitamin, accolade, singular, none of those things matter. Capsular contracture 100% of the time is an autonomic genetic predisposition based on the immune system's response to a foreign object in us, because pacemakers do the same thing, knee replacements do the same thing, meshes do the same thing, and unfortunately it's the nature of the beast, right? Truth is, you have less risk of getting capsular contracture than you do getting in your car and getting into a major catastrophe. Do we not get in our car and drive to work every day because of that risk?
Every day.
Every single day, right? Exactly, okay? So we treat it. We don't need to do more surgery. We treat it. So you would give your left breast how much softening in just the 5 days you've been here?
Left would be 85%.
Okay.
Hands down.
All right.
It's very responsive, not as high and tight as it was before.
And the right breast got how much softer?
The right was 75.
Beautiful. So in 5 days, those are great numbers because Quinn's going to go home and keep doing the massages and get that much better with the goal of being 100% softer. So we really only have a little bit more to go. In the beginning, you were having some pain and discomfort in your breast. So like when you woke up in the morning, it was tight and uncomfortable. And I think the analogy I used was lump in your throat kind of feeling, right?
Absolutely.
Okay. How about now when you wake up
now
in the morning?
I have had some, I've had some early mornings here, but I've had restful sleep and waking up not feeling the implant lodged in my throat every time I was to roll over and get out of bed. So
exactly.
Yeah, it's completely gone. So I'm very grateful for that.
Our pleasure. You did awesome. There's a compliance part, everybody. You got to do the massages and the things we ask you to do. If you don't do those, it's not about the magic machine or what we offer here. So kudos to you for being able to do that. And what did we do? Basically, the capsule is a shell that grows around the implant that tightens and it has nerve endings and it hurts and it's uncomfortable. And when we stretch it, loose it, use our technology and all kinds of the other things, that capsule loosens, it takes the pressure off something called nociceptors. Nociceptors is a big fancy word for the nerve ending receptor that creates pain. So we see the same type of thing in patients who have frozen shoulder, which interestingly is the kissing cousin of breast implant contracture. So anybody out there with breast implant contracture, I bet you have already had a bout with shoulder problems or frozen shoulder, and if you haven't, you're prone to it. So if you ever get a shoulder problem, give us a call because they may be related, and both of those are treatable. Long story short, just like we would treat a patient for frozen shoulder, we have a specific program that works the same way. So this is not smoke and mirrors. This is not magic machines. This is not some sort of cockamamie program that we're presenting here. We are all evidence-based medicine researchers. We're all licensed medical professionals. We're not doctors, but thanks for that. But we provide what we do on the basis of research and evidence-based medicine. How can we justify that this works? A, patients like Quinn do videos. We've got lots of them. We have over 10 years experience. We have 8,100 patients treated to date. We have a 90% success rate for patients that are applicable over a 10-year period of time versus surgery, surgical stats. Really depends whose research you read, but if you compile all the data, if Quinn were to have another surgery to have this done, she has a 70% chance of re-encapsulating. If she were to have a second surgery, even a different surgeon, even different implants, she has a 90% of encapsulating again. So we tell everybody, there's not an orthopedic or neurological surgeon out there that puts in a prosthesis or an implant and takes the patient back in for surgery to redo their problem because of scar tissue and adhesions. They send them to the local rehab place and they do therapeutic intervention, just like we're doing here, to fix the problem non-surgically, which is why we implore all of you. We know your surgeons, we work with your surgeons, we love your surgeons, we respect all of them very highly, but give the non-surgical conservative treatment approach a chance first before you go for surgery. You've got nothing to lose. Yeah. What if it works? Yeah. You don't have to have surgery, right?
Exactly.
That's exactly what Quinn did.
That was my goal.
Right. And by the way, Quinn is not around the corner. Quinn flew to us from the other side of the United States, so we're in South Florida. She came from California, so
yeah, it was worth it.
Must have been worth it.
Totally worth it.
Did I tell you about my last patient who flew from out of town?
No.
Came from Russia.
Russia?
You can't get through Europe because of COVID.
Wow.
Capsular contracture is such a big deal. Our patient flew from Russia, had to reroute through Turkey, and come to us for a 5-day fast track. She did just as amazing as you did.
Yeah,
so we appreciate this. Anything else? A woman right now is watching this, has contracture, doesn't believe this works, was told by her surgeon that surgery is the only option. Any advice or pearls that you can give in that process that maybe you went through too?
Sure. Do your research on your own. Check out the Aspen page and see a lot of these testimonials. That's actually what brought me in. And I was able to do a virtual consultation with him that made me more knowledgeable and woke me up to some of the things I was experiencing. And yeah, just trust your gut.
Awesome. Did we script any of this?
No.
Did I just ask you on the spur of the moment to shoot a video?
Yeah, and I'm glad I did.
What are we shooting this video with?
An iPad.
An iPad sitting on a stand.
Yeah.
Exactly.
Yeah,
awesome.
We're no production company. I'm in production. This is off the what do we call it? Off the cuff.
We do have a ring light though in our defense.
No, but that's like Instagram amazingness. So yeah. Thank
Quinn,
you so
we
much.
appreciate this. Anybody watching this right now, can I share your email so they know you're a real person and they can communicate with you if they had any questions about this? Awesome. So listen, everybody, we shoot these videos periodically. Hit that subscribe red button down below. Like us, share us, tell your friends about us, share this information with your surgeon. Our #1 issue right now is battling the information pipeline getting to you versus what you have to rely on, which is the surgical community telling you you only have one solution, which is not the truth. So hit us up. Banner below has the 877 number on it. Call us. You will speak to a live clinician. There is a good chance you can speak with me or any of our other clinicians who provide treatment for this. And that's it. Thanks, guys. Thanks, Quinn.